Today's December 18th, 2015, and Amy, you've been here for some time. We want to learn a little bit about your experience, so please tell us how old you are, where you come from, and how long you've been sick for at this point.
I'm 16. I've been sick for about 4 years, and I'm from Texas.
Yeah.
Yeah.
So Houston, Texas, obviously a pretty progressive area.
Yeah.
You've had quite a bit of treatment over the past 4 years or so. Tell us a little bit about what occurred in you. What were the first symptoms of your illness? What were kind of the first signs that you were becoming sick?
Well, the first symptom I got, we were just on our way somewhere in the car, and all of a sudden my face started feeling like bricks were like tied to it, and it was being dragged down. It was like paralyzed, and I couldn't move it. And then after that, I used to be a really active tennis player. I was about to start competing, and eventually just like my ankle gave out, or I almost passed out one day, and my knee gave out, my hip gave out, and I couldn't walk after practice, and we really knew something was wrong. So we just started looking and searching for everything.
Sure.
Yeah.
And so what is kind of the first, as you start to begin to experience some of these little discrete things, what's the first place, and Monica, you can maybe give us a little insight into this, but where do you turn first when you started to experience these
because
things?
of her symptoms starting in her joints, I went to an orthopedic doctor first.
Okay.
And,
Texas Children's.
well, yeah, we did eventually go to Texas Children's because I couldn't get into doctors, so I just went ahead and brought her into the emergency room at Texas Children's.
Sure.
And then we were sent to a UT rheumatologist.
Okay.
And an infectious disease doctor. So, and then we eventually found a doctor with Lyme that would test her for Lyme.
So apparently it was kind of on your radar early on. So you start to experience some of the joint pain, and so you knew at least enough to kind of look into that route, or was it a doctor that suggested that to you?
No, it was me. I did research, and it kept coming up with all the signs and symptoms.
Okay.
But they would refuse to test her for Lyme because they told me that there was no Lyme in Texas.
No Lyme in Texas.
Yes.
What other symptoms had appeared? Obviously, it takes quite a lot more than just a little bit of pain there. What else began to happen to you over the course of those first few months?
I started to about probably like almost every single time I got up, I'd black out and have to like sit and regain everything. My vision would go blurry. I would get ringing in my ears, shortness of breath, extreme fatigue, extremely bad insomnia. I'd be up till 7 a.m.
Anxiety,
panic attacks,
depression,
yeah,
bouts of extreme pain when we end up in the emergency room for no known reason.
Yeah, my balance was extremely bad.
And that's pretty alarming. Obviously, for someone at the time, you're 13, 14, 15, getting older, and you're experiencing just really everything. So your brain is, you're having all these cognitive issues going on. You don't know if, from your perspective, maybe you think you're going crazy.
I
the
thought
doctors
I was dying,
in some capacity might be indicating that to you as well. And you're experiencing all that profound pain. You said you're experiencing the profound fatigue. How often and how long would you be in bed for periods of time?
I would stay at home a lot because then I would just kind of, sit and lay, and there would be periods of time where my leg would go paralyzed and I couldn't walk for 5 days, or I'd have extreme pain and be stuck in bed for a long time, or just pain and everything, or I'd just be so tired I couldn't even get up from my insomnia. I'd just have to stay in bed all day because I could barely function.
Yeah. And Mom, what was it like for you to watch this? Obviously, you're a third party watching your daughter just in bed and experiencing such profound pain. What was that like?
It was terrifying and heartbreaking. I had knots all the time, and I just would tell her that I was not going to give up hope, that I would continue searching, that God was going to show us where to go, and I was going to continue searching until we found some place to get her help.
How many different doctors did you see over the course of those 4 years?
We saw around
12.
Yeah, around 12 doctors,
12
different doctors.
Specialists from, you mentioned rheumatologists,
Yes.
orthopedics, you saw, cardiologists, neurologists.
Yes, we saw a cardiologist. Yes, neurologist. We saw, orthopedic.
3 different Lyme doctors.
3 different Lyme doctors we went to. We went as far as Connecticut.
Yeah.
We flew to Connecticut.
And of course, Connecticut's going to be considered the Lyme capital of the world.
Yes.
So you're seeing
Yeah.
these premier doctors all
Yes.
over the place, in a place like Houston where medicine's already pretty progressive.
Right.
And they're concluding. Well, what conclusions did they come to? What were the official diagnoses before
They
you arrived
said
here?
that I had fibromyalgia and that I was depressed and it was all in my head.
Yeah, and that's terrible to hear that. That may appear to be like a slap in the face. So it's all in your head. You have depression, despite the fact that you're experiencing all of these things that seem to be physical, seem to be neurological. You are depressed and you have unspecified body pain, which is, of course, very, very tough because it doesn't indicate any causal element. And so you guys are suspecting Lyme, suspecting that there may be other infections, and you're now having heart issues. I assume heart palpitations, and the cardiologist is saying that everything's okay. What were their conclusions on that?
He just said that it was something that kids could have. He overlooked it, and we've come to realize that her heart rate is super high.
Okay.
It's very, very high. It's not normal.
Yeah.
She's not just
Yeah,
high
she has
energy.
an irregular
No.
EKG.
Sure.
Yeah.
Yes.
And so they did. Were there EKGs done before and they didn't see anything
Yes.
wrong with
Yeah.
that?
Yes, they just said that there was.
And usually in younger kids that there can be things like that, and it's just a mistake in the machine.
Okay.
Yeah.
So they chalk up the aberration to be a mistake in the machine. And so you arrive here at Sponaugle Wellness Institute day one, and you're sitting down with Dr. Sponaugle and you're discussing some 600 different biochemical markers, and he looks at this EKG and he says you have what was it that he diagnosed immediately?
He said that she had built an extra bridge
it's
in
an
her heart.
electrical bridge
An
that
electrical
was built.
problem, yes.
Which was something that had been missed prior to that.
Yes.
In 4 years of time, you had nausea, you had some gut issues, I'm sure.
Severe nausea.
Yeah.
Yeah.
And that was pretty consistent. And and you had went to
Almost
doctors and the
100%.
doctors had no causal.
No,
Yeah,
So she
they
came
didn't
up
really
with-
even focus
Yes.
on that.
They said there was
Yeah.
nothing wrong with her. We had CAT scans, several CAT scans done, and ultrasounds, and they said that they found nothing.
Yeah,
Sure.
everything was
It
fine.
was normal.
Yeah.
And day one, when you're sitting down looking at those numbers, what does Dr. Sponaugle see is immediately wrong with the gut?
He sees that we have pancreatitis,
Yeah.
severe,
A large, he said an alarming amount of parasites, gut parasites.
So you're surprised to find out that you're not just sick, you're really sick when you get here.
Yes.
Yeah.
And mold, we had no
No
idea
idea.
about mold, and she had really bad mold issues.
I have the double.
Just
Gene for
the
mold.
genetics, yes,
Yeah.
for the mold, for her and her body to be able to clear it out of her system.
Yeah. And that originated probably from the home, maybe.
Yes,
maybe
which we had no
Yeah.
idea. We had a new home.
Yeah,
Our home was only 4 years old, so I was
Yeah.
thinking there's no way we could have mold.
sure.
And sure enough, we had mold in our air conditioning through the units and in the carpet. So
When you can't metabolize that, when you can't get out of your body, that certainly becomes very, very problematic for you. And so you mentioned the pancreatitis, but the systems of the body all begin to fail. A lot of those fatty organs begin to be kind of exercised and exhausted, liver, kidneys, and that's particularly problematic. And so when you get here, you knew you were overly toxic. So you mentioned the mold. Any industrial toxin exposure?
yes, we had a
Extreme,
huge
yeah,
amount of industrial
a lot.
toxins.
Where does that originate?
We're thinking from the plants.
Houston,
yeah,
because we're an
all the
hour and a half
plants.
from all the
Okay.
Yeah.
chemical plants.
Okay.
Yes.
And that's kind of the world we live in.
Yes.
Yeah.
It's kind of hard to avoid.
It's sad, but
Yes,
Yeah,
avoid those
it's
things
unavoidable.
right now.
So you're storing all these toxins, and for previous to you even becoming sick, you're storing these toxins, your immune system is becoming suppressed. And we in fact found Lyme amongst other things. I'm sure we found, what other co-infections did we find?
Babesia, Bartonella, MS,
Start of
start of
MS,
MS.
rabbit
Um,
fever,
what is-
mycoplasma pneumonia.
I think that was it. Yeah.
So your immune system shut down, and you're just collecting all this stuff over the years. And so when you get here, it's just a combination of pronounced infection, a lot of toxin load, and you obviously feel terrible. You're in bed all the time, experiencing the anxiety, the insomnia. You're experiencing the pronounced depression, having been, and obviously as a teenager, being in and out of hospital, being in and out of doctor's offices, not understanding what's going on, of course, is going to be terrifying, and just very, very scary for you. And
Yes, at that point she had lost all hope. I told her that, I would never give up and never stop fighting for her, even though,
And so, never stopping fighting brings you here.
Yes.
Yeah.
Oldsmar, Florida, Sponaugle
Right.
Wellness Institute. You sit down with Dr. Sponaugle. He immediately begins to recognize all these components, and we begin to treat. Let's talk about the intensity of your treatment. How long have you been here?
7 months.
7 months.
Almost 7
Yeah.
months.
And
Yes.
typically, if an individual is going to be here for 7 months, typically an excessive amount of biofilm infection load in the body is going to be a major player. And so you had certain obstacles for you. And so we worked through that. What was that like for you? What was the experience like for you treating here?
It was very difficult. Yeah, it was exhausting. The first couple months, since I had so many industrial and environmental toxins, I could only do detox, so it was just overloading my kidneys. They had to take it slow and made my pancreatitis worse. But after we just started busting through, and I would kill every day, all the time, and it was
From day one,
Yeah, from
her
day
first
one.
detox, we went home and she got 103 fever.
Oh, Lord.
Yes, and which was, we knew, I figured it was a good thing, but her immune system had kicked back in. And she continued the next day, she had 103 fever. And she's had,
I've had
every single
103
day,
fever
she
for-
has had 101 to 103 fever every day. Just after detox, her immune system was kicking back in. And it was amazing. I was so excited.
Yeah. And,
Yes.
And the verbiage is, well, that sounds scary. You're killing.
Yes.
Well, that's a great thing.
Yes.
But the problem is you feel
You
terrible.
feel bad, yeah.
You're
But
producing-
it sucks, but it's a great thing. Yeah, it's exciting.
And
at
so
the same
you
time.
start from day one. You're on it, and we talk
Yeah.
about the ebbs and flows of the way treatment goes and how it goes up and down. So you stayed pretty
Yeah.
low for a while. What was
Yeah.
it like? What was it like coming out as we really started to get your immune system working? We really started to work with that. Your pancreas settled down. All of that happened. What was that like as you began to improve? What symptoms went away? How did you progress?
The first thing that I really noticed, we were in the car and I was just so excited, as I had so much energy. It's just one day after, being so tired from all the extreme killing, I was just like, I have so much energy, I feel so much better, and my pain has definitely decreased, and my balance has gotten so much better. I can finally sleep.
All right.
I'm so happy about that.
Her insomnia is gone,
It's
which,
just totally gone.
yes.
Which means your insomnia is gone.
Yes, no, really, yes,
All my
definitely,
anxiety
really.
is gone.
Yes, no more panic
Yeah,
attacks.
no
her
more
panic
depression.
attacks. Yeah,
That's
her depression
incredible.
is, yes.
That's incredible.
Yeah.
She had hope.
All my
I
infections are
started
gone.
to see hope in her again,
Yeah.
and she would express, "Mom, my hope is back. I really do think I can get better."
Yeah.
Yes, and that was the
Yeah.
best thing to see for me, because when I was crushed, when she would say that her hope that it was gone.
Yeah.
Yes.
And that's probably the worst of sickness. You talk about all the physical malady and what that does to a body, but the hopelessness is really that's the worst of all. Because when you're ready to quit, your body's going to quit.
Yeah.
But you weren't ready to quit. You guys got here. You pressed through it, and that's one of the things that is just incredibly apparent, is that you're strong enough to push through that. And so here you are. Here you are, 7 months, and you've come out of it. What are you looking forward to doing? Cognition's back. Your strength is back. You're ready to go back play tennis. You're ready to go back and be a normal kid. What are you looking forward to doing most in the next coming days and the coming months?
School.
School.
Yeah. I'm so excited to get back to school and see my friends, and of course play tennis again. I miss that so much.
Yeah.
Yeah.
So back in the classroom, educating yourself. This has been, of course, an educational experience for you.
Oh yes, and I love all the medical field and stuff. I want to become a nurse.
Yeah.
So it's so much fun to learn everything.
And I do understand unofficially that Dr. Sponaugle has extended an offer for you to come here and work. So
Yeah.
16 years old. 16 years old. You've got a few years until you get there, but
Yeah.
that'd be incredible.
That would be really awesome.
I know
Yeah, I would
he
love
you know, we
that.
love seeing you around, because your attitude's going to be infectious, and that's something that in the medical field as a nurse, that's going to be something that becomes incredibly incredibly important to you and your success. So that's so exciting that we didn't scare you off from that field.
Yeah.
So
Yeah.
tell us this, if you have one message, one thing you could say to a 16-year-old girl like yourself, someone who's experiencing what you're experiencing, maybe they feel like hope for becoming better is gone, that's just completely out of reach, they can't get there. What would you say to those people?
You know, I've been there and I've been really bad and everything was gone, but there is hope and there is places like here. It's just, you can get better. It is possible, and God has a plan with you, and keep your faith and everything will get better.
Thank you, Amy. And Monica, if you could talk to a mom, if you could give them one message, what would you say in a nutshell about your daughter's experience and what you can share with
To
them?
not stop searching, and this place is they're miracle workers. Yes, here we couldn't have came to a better place. This is where we were supposed to be, and she is now going to have her life back.
Well, on behalf of Dr. Sponaugle, on behalf of Sponaugle Wellness Institute, the staff, we are just so happy to have been a part of your story. Thank you for your testimony. I think an incredible story, and we're so excited to see that you've got your life back. And so please just keep in touch. Let us know what we can do when you're ready to submit that formal job application. Be ready to take that. We'll have somebody look it over, but I'm sure you'll be in. So thank you guys.
Yeah,
Appreciate it.
Thank you.